All right, so we're just going to be doing a review of just like the very basics from Psych, because that will be also included a very small portion, but on your medical surgical HESI. Okay, so just to review some medications, the benzos. So we want to be careful with respiratory depression. So our respiratory rate dropping, being slowed, and increased suicidal actions. So these are like our PAMs or AMs. So alprazolam, clonazepam, lorazepam. Lorazepam specifically is used for alcohol withdrawal, and so the CWA scale determines the dose that they're going to take. And this is just to help, yeah, with those withdrawal symptoms. Midazolam, Versed needs to be gradually tapered. The same with all of these; they need to be gradually tapered. If you stop taking a medication suddenly, it can have reverse psychosis and all those crazy things. So, withdrawal medications, chlorodiazepam epoxide or Librium. This is for alcohol withdrawal. You get dizzy, drowsy, orthostatic hypotension, EKG changes, dry mouth. So, lots of side effects. Nicotine, side effects can be tachycardia or dysrhythmias because it's nicotine. It has the same effect in cigarettes, but this is just to get rid of the smoke aspect of their addiction. Nausea, vomiting, anorexia, and indigestion. Okay, bupropion is a smoking cessation medication. Okay, and SSRIs, side effects could be headache, insomnia, suicide attempts in the first few weeks because they have more energy to follow through. Nausea, vomiting, diarrhea, dry mouth, serotonin syndrome, which just includes like signs and symptoms like flu-like signs and symptoms. So this is things like citalopram, escitalopram, fluoxetine, oh, why did I have that twice? I don't know. Sertraline. Okay, MAOIs, these kind of medications, you just want to make sure not to pair it with anything like tyramine based, so aged Cheez-Its or meats. SNRIs include venlafaxine. It's basically the same as SSRIs, just a little different in terms of hormone reuptake. Antihistamines, so diphenhydramine, it's used to treat extrapyramidal, oh my gosh, you guys know what I'm talking about, EPS. Dizzy, drowsy, anaphylaxis can be caused by Benadryl. Hydroxyzine or Atarax is one that can be used to treat anxiety, depression, but it's also an antihistamine. Bipolar disorder, we're going to be using lithium. The range is very small, it's 0.5 to 2.0. Nausea and vomiting is the first sign of toxicity. Phenobarbital is an epileptic drug that can also be used to treat bipolar disorder, as well as valproic acid or Depakote, anticonvulsants, sometimes used, again, to treat bipolar. Antipsychotics, there's first gens. They have the more side effects of EPS and neuroleptic malignant syndrome, so super high fever. Second generation, less EPS, but more metabolic syndrome, especially olanzapine. So like, sorry, I have to sneeze. So it just causes weight gain, higher risk for diabetes, hypertension, things like that. As far as clozapine for second generation antipsychotic, you need to check the white blood cell count because it can cause neutropenia. Sleep aids include zolpidem, which can cause a severe allergic reaction, so always be watching for that, as well as trazodone. And those are just there's a lot of side effects associated with trazodone. Okay, so general tips as far as psych goes. First, we want to establish trust, build rapport, and relationship, because then it will be easier to implement all the other things. So as long as that foundation is a good relationship of trust, that's what we want to do first. Use presence, so walking with them to the room instead of just saying, go to your room. If there's misbehavior, or even just silent presence, not even necessarily using words, but just being there. Use concrete examples. Don't dive into like abstract. Just too many people with mental disorders do not understand abstract. Use things like it seems like you are feeling. So like point out your observations so that you can call to attention what it is that they're doing or feeling and spark a conversation. Don't ever assume, right? Like use your context clues. But they still retain their rights. So they have the right to refuse the medication unless it's court ordered that they have to take the medication. They have the right to, not go to group that day or whatever it may be. But first and foremost, safety. So as long as they're safe, they have that right to refuse. Um, and then prevention rather than reaction. So we want to prevent things rather than having it happen and then react to it. So using distraction, validation, avoiding power struggles. So use show of force if someone's being violent, gathering together a lot of staff members and just standing there until they back down. Um, Obviously, we want to go from like least to most invasive. So start by talking with them, like be directive, and if like the last thing we want to do is use like a chemical or a mechanical restraint. Okay, that's like our last thing. So that's why prevention is important. So we don't have to use restraints. If someone's in a panic state or they're unsafe, don't leave them. Just use simple, clear directions. Don't attempt to teach anything. We know that there has to be optimum environment for teaching. That's just not it. Consistency is key. So the same caregivers, the same rules, all the caregivers are aware of those rules for that individual and need to set clear limits. Okay. There's some terms. Transference is patient relates you to somebody. It could be good or bad. So they're like, you remind me of my Aunt Jenny. Countertransference is when you relate the patient to someone you know. This patient reminds me of what my mom went through, or la-di-da. Electroconvulsive therapy, ECT, we don't call it shock therapy. It's used for severe depression that's not working, like not being treated with normal medications. After, it's just like any other surgery, you're watching their ABCs, vital signs. You may need to reorient them because it can affect their short-term memory, but it will eventually come back. Okay? Anhedonia, no pleasure. Avolition, no motivation. So some disorders, schizophrenia, we have positive symptoms. So these are added to the normal state. So things like delusions, those are added to your normal state. Negative symptoms, meaning it takes away, so like avolition or anhedonia, lack of pleasure, motivation, things like that. So it takes away from the normal state. Cognitive changes, so difficulty understanding speech, difficulty speaking, not making any sense, and mood changes, so associated with depression, anxiety. So figure out so like with schizophrenia, if they're hearing voices, we want to figure out what the voices are saying and see if they pose a safety risk either to the patient or to somebody else, and then act to make sure that that's not carried out. Packaged food decreases the paranoia. So like, I can't eat that. Someone poisoned it. Well, if it's packaged, comes from a vending machine, they're more likely to eat it. Reorient by using their name. This goes for most of these disorders. Using somebody's name brings them back to self and orients them back to time and place. Okay. Anxiety and depression. So we want to assess for suicide thoughts or plans. It puts someone at a greater risk for suicide if they've had a past attempt of suicide. People who are talking about like they're giving away all their things. They're talking about how they're totally fine now, total 180. They have no problems anymore. We would be more concerned as a suicide risk. They're going to be placed on a one-on-one, so someone's going to be with them at all times. And then harmful items will be removed from their room, even things like shoelaces or the cords or vitals, stuff like that. Okay. And their call light will probably be removed. That's why they'll also have a one-on-one. Grief, it can be complicated, so they're not taking care of themselves. So even if someone is grieving and it's only been 3 months, we all have like 3 months is not a lot of time, obviously, but if they're completely neglecting self, they're not showering, they're not eating, not drinking, it's still considered a complicated grief, and even though it's only been 3 months, because they're just not taking care of themselves. Disenfranchised, it's not recognized by society, like abortion or the death of an ex-spouse, or a miscarriage. Okay, there's the Kubler-Ross grief cycle. That's really important. There's denial, anger, bargaining, depression, acceptance. Not everyone moves in a sequential order or on a timely fashion, but those are just the general phases people go through when dealing with something causing grief. Okay, bipolar switches between depression states and manic states. So during the manic states, it's especially important to make sure they have finger foods, help them sleep, because their physical body is in overdrive, and it's eventually going to tire out and have bad like fluid and electrolyte imbalance problems and stuff like that. Writing materials can help with communication. So if they're not speaking to you, try giving them like pen and paper and see what they write. OCD, we don't want to like stop them in the middle of their compulsion. Teaching is not good either while they're in the middle of their compulsion. Allow them to finish and then teach afterwards. And the goal is to make small goals to slowly decrease their compulsion. So instead of washing your hands 5 times today, how about you wash them 4 times, like that? Okay, crisis state, the goal is to return someone to their pre-crisis state. We want to focus on the present and most recent problems. So if someone had a divorce 5 years ago that still affects them and someone lost their job yesterday, we're going to be focusing on the loss of their job. Okay, abuse, we want to plan escape. Careful of flyers. Like if you give somebody a big old flyer, they take it home, their abusive partner might find it and the abuse may get worse. So but still come up with that plan so the person who doesn't necessarily want to report it in the instance has a way of escape in the future. It is a mandated report if a child or an elderly individual is involved or has been abused. However, if it's partner abuse, like domestic violence, the consent to report needs to come from the person being abused. So especially in these questions, you want to be careful not to give your own advice. So if I were you, I would leave this individual. All you do is offer support, offer a plan of safety, and give them the resources. If you want to report, this is how you do it. We can keep you safe, stuff like that. You want to screen all women for domestic violence, especially during pregnancy. Domestic violence can get worse. Sexual abuse, make sure to collect all evidence before washing anything and then treat the possible effects like pregnancy, STIs, etc. First and foremost, with all of these, we want to make sure that the person feels safe. Okay, eating disorders could be bulimia, so binge and purge, anorexia, just not eating, or binge eating, just eating a ton and not purging it. Careful with refeeding syndrome, especially with anorexia. It can cause lots of fluid and electrolyte imbalances if you feed a person who has not eaten for months and months too quickly. And then another sign is Russell's sign. It's just the callus on the finger from bulimia, from like hitting the teeth and like using it to gag yourself to throw up. Okay, addiction, there's alcohol, delirium tremens. The signs and symptoms are confusion and seizure. It occurs about 40 to 48 hours after alcohol withdrawal, or like during. The peak is 2 to 3 days and it lasts about 2 to 5 days. Treated with anticonvulsants, lorazepam, stuff like that. Wernicke's-Korsakoff syndrome, it's a thiamine deficiency. You give them a banana bag of vitamins. It can turn into encephalopathy, which asterixis hand flap is a sign of encephalopathy is reversible. However, psychosis, the Korsakoff psychosis, is not reversible. It's the inability to learn new things, dementia, decreased vision, stuff like that. Disulfiram or antabuse, you need to sign a contract actually to start taking this medication because it can make you violently ill if you're taking this and take any alcohol containing products, including like Listerine or something. There's also Librium, clonidine, and naltrexone for alcohol withdrawal. AIDS. If there's an inhalant addiction and they come in overdosed on whatever, make sure to remove the clothes because they can still inhale the inhalants through the clothes. Okay, so then there's personality disorders. There's borderline, which is the most common. They're manipulative, splitting, so either someone's all good or all bad. Idealization, devaluation, so someone's amazing, devaluation, someone's the worst human being they've ever met. Throw tantrums, low self-image, unstable relationships, fear of abandonment. They might start threatening to hurt themselves or start cutting if they don't get their way. Somatic symptom disorder, they're very preoccupied with their health for more than 6 months, may demand unnecessary tests, doctor shop, so one doctor refuses to treat them, they go to another doctor, so on and so forth. Factitious disorder, they induce or fabricate symptoms. By proxy, they put the symptoms onto someone else. Munchausen is a severe form of factitious disorder, causes self-harm that leads to hospitalization. It could be by proxy. So a lot of times this is when like a mother requires child to get some treatment for a simulated injury. So I don't know, there was that case of that kid who ended up killing her mom because her whole life she found out she was giving her medications to make her unable to walk and so that the mom could care for her as if she was in a wheelchair. I don't know. It's this big thing. Okay. And that is it. The review of just psych. It's not comprehensive by any means, but those are just like some key points to remember going into this exam, but especially for your, what are they called? Exit HESIs, because there are psych questions in there. Okay. Good luck, guys.